More now on that outbreak of swine flu. Officials are reporting 20 U.S. cases of swine flu in 5 different states, but not here in Michigan. We're talking live tonight with Dr. Eden Wells from the Michigan Department of Community Health. Doctor, thanks for joining us this evening.
Thank you for having me.
Okay, what do people need to know first and foremost about swine flu?
First and foremost, what we know about the swine flu at this time is that it is a unique and new strain of influenza that has first, as we know, arisen in the southwest part of the country in California, and we're beginning to see increasing cases across the country. What we are learning here, at least at this point, and what people need to know, is that we are seeing human-to-human spread of this influenza, which is the same way seasonal influenza is spread. And that people need to know that many of the same recommendations that we would give you during a seasonal influenza would be those recommendations that we are advising during this time with the threat of swine influenza.
And some of those recommendations would be?
We would really recommend that if anyone is feeling sick or experiencing any severe symptoms, including cough, fever, fatigue, or sore throat, certainly with the flu often you can get some chills and headaches and body aches, they should contact their physician, and if they feel sick enough to be seen in a healthcare setting such as hospital or doctor's office, they should certainly do that. We are currently communicating extensively with our local health department partners and doctors and hospitals throughout the state with updated advice, which is coming from Centers for Disease Control in Atlanta, on what to do if they see patients who come in with a flu-like illness, especially if those patients have had a recent travel to affected areas. And as you know, we're very interested in those people who have recently been traveling in Mexico or in the San Diego, California, or San Antonio, Texas areas of the country.
Okay, Dr. Eden Wells from the Michigan Department of Community Health, thank you so much. So much information out there. Thank you for talking with us tonight. We're going to have more on the outbreak coming up in our second half hour.